Hi everyone, my name is Jaren and I will be talking about the International Classification of Functioning, Disability, and Health, also known as ICF. In this PowerPoint, I will be going over what is ICF, aims of ICF, the ICF model, coding in ICF, some of the qualifiers, advantages and limitations of ICF, and the relation to health analytics. The ICF is known as International Classification of Functioning, Disability, and Health. ICF belongs to the family of international classifications developed by the World Health Organization. The overall aim of the ICF classification is to provide standard language and framework for the description of health and health-related states. The ICF was officially endorsed by the World Health Organization on May 22, 2001. The International Classification of Disease, also known as ICD-10, and ICF are complementary. Health conditions such as disease, disorders, and injuries are classified primarily in ICD-10. The ICD-10 provides a diagnosis of diseases, disorders, and other health conditions, and this information is enriched by the additional information given by the ICF on functioning. Therefore, when these two information come together, it provides a broader picture of the health of people, which can be useful for decision-making purposes. ICF is a multi-purpose classification that is designed to serve various disciplines and different sectors. ICF was developed to provide a scientific basis for understanding and studying health and health-related states. It is a way to establish common language for describing health and health-related states in order to improve communication between different users, such as healthcare workers and researchers. It allows comparison of data across countries and healthcare disciplines. And finally, it provides a systematic coding scheme for health information systems. The ICF model organizes information into two parts. The first part deals with functioning and disability, while the second part covers the contextual factor. The body functions and structures refer to the functioning at the level of the body. The body functions include the physiological and psychological functions of body system. The body structures are the anatomical part of the body, such as organs, limbs, and their components. The activities refer to the functioning at the level of the individual and the activity limitation they may experience. These are the execution of a task or action by an individual. The participation refers to the functioning of a person as a member of society. This is looking at the involvement of people in all areas of life and the participation restrictions they may experience. The environmental factors are the physical and social environment in which people live and conduct their lives. The personal factors define the background of an individual's life, and they are not classified in ICF. However, they are here to show their contribution, which may have an impact on the outcome of various interventions. Functioning is an umbrella term for body function, body structure, activities, and participation. It is the positive aspect of the interaction between a person's health condition and the contextual factors. Disability is an umbrella term for impairments, activity limitation, and participation restriction. It is the negative aspect of the interaction between a person's health condition and the individual's contextual factors. As I have mentioned earlier, the ICF is organized into two parts. The component of those parts are denoted by prefixes in each code. B for body functions, S for body structures, T for activities and participation, E for environmental factors. These letters are followed by a numeric code that starts with the chapter number, followed by a second level and third and fourth level. We can think about the structure like school textbooks. In our textbooks, the information is organized into chapters and subheadings to help locate the information we are looking for. An example from the component of body function is shown here in this slide. So for the code B2, the level is sensory functions and pain. It's considered the chapter level. B280 is the sensation of pain, considered second level. B2801 is the pain in a body part, considered third level. And finally, we got B28013, which is pain in back, considered fourth level. ICF qualifiers are the extent of a problem experienced by a person in a specific ICF category. The ICF codes require the use of one or more qualifiers, and these are coded as 1, 2, or more numbers after a point. Every code should have at least one qualifier. Without qualifiers, codes does not have any meaning. The World Health Organization proposes that components of the body function and structures and activities and participation be quantified using the same generic scale, which is shown on the slide. The qualifiers are added to the category followed by a dot. For example, B280.1 is referring to mild sensation of pain from the previous example. Environmental factors are quantified with a negative and positive scale that can be seen on the slide. The scale denotes the extent to which an environmental factor acts as a barrier or a facilitator. A barrier is identified by adding a dot, and a facilitator is identified by adding a plus sign. Some of the examples include E150.2, which is moderate barrier, and example E11514 plus 4, complete facilitator. ICF qualifier of 8 is used when there's insufficient information to quantify the extent of the problem. There are many benefits of using ICF for both the patient and health professionals. An advantage for the patient is the integration of the physical, mental, and social aspects of their health condition. All aspects of a person's life is incorporated into ICF instead of just focusing on their diagnosis. Diagnoses are extremely important, but identifying limitations of functions is often the information used to plan and implement interventions. For example, an occupational therapist can see how a patient is performing his or her daily activities and take notes on the patient's functional abilities. That information can be used to determine the extent to which the individual's abilities can be improved through therapy. Rehabilitation therapists can use ICF not only on their daily work with the patients, but also when working with other medical disciplines. Some of the limitations related to ICF complexity is the difficulty understanding and implementing the ICF in its entirety. Completing the assessment form is time-consuming, therefore it is a long and drawn-out process. In relation to ICF context, the framework is unsuitable for use in the acute stage. An example of how the ICF relates to health analytics is by the incorporation of ICF in electronic health records. Electronic health records support decision-making through logic systems. ICF can advance physiotherapy practice and research by allowing data sharing by the use of electronic health records. When the ICF qualifiers are being routinely assigned, the electronic health records can automatically generate reports and calculate overall level of functioning scores for each individual. Having the system produce ICF-enhanced tools at the time of a clinical encounters could assist the clinical decision-making of physiotherapists. Incorporating the ICF and EHR, physiotherapists are able to leverage the capabilities of EHRs and share information with other healthcare providers. ICF has been implemented in a variety of settings, such as in the area of medical and occupational rehabilitation. ICF acknowledges that every human being can experience some sort of disability in their lifetime. Thus, it mainstreams the experience of disability and recognizes it as a universal human experience. When shifting the focus from cause to impact, it places all health conditions on an equal footing, which can be compared using the ruler of health and disability. Use of ICF and ICF provides a meaningful picture of the patient's health, which provides a better management decisions. These are the references I used for the slides. Thank you.